Minya Ashraf.
I probably should do a little.
And this is the reception when when a patient has just reached. They come here and they find the receptionist, stroke cashier, Jackie. Yes. This is it. Healing Grace Medical Center. AsOne Ministries. Patient comes in, goes here. Oh, they are in the pharmacy. And then,
This is Zitromax. We have this.
Yes, these are the thromycin.
Yeah.
They are under penicillins.
Yes.
Yeah. This one are the thromycin and Bicrox, they are also under. Then this one, Metro, it is under macrolides. If you still remember pharmacology.
What is it called?
Flagell.
Flagell. Oh,
Fragile, yes,
Flagell.
fragile.
Yes.
Yeah, for us we call it fragile, and I think
For
fragile
fungicide.
is a trade name.
Yes.
Then metronidazole is a generic name.
That's a generic name?
Yes.
Yeah, I wouldn't know.
so that is the computer system that we use. When a doctor prescribes a certain medicine, then a pharmacist will see it here and be able to dispense it through the window, depending.
Still, we are using this to dispense our the injectables. Now, this one is a nurse. She knows very well that we do. Immediately after administering drugs, you will have to document. I've given such and such a type of drugs in such and such milligrams
At this time to so and so.
So and so. So we are using this system still to dispense drugs.
Okay.
So here we are trying to remedy paperwork.
So they have doxycycline here too. Right here.
This one there, doxycycline.
So how much would that be, a capsule, doxycycline?
This one.
So if you sold that, how much do patients pay for that?
For this one, like
this one.
a whole pack or
The whole pack.
So you would usually give them a dose of maybe one per day for 7 days. How much?
This one, it depends on the amount, because this one, you normally give it one or D. Sorry, one would be D.
Oh, twice a
Twice a
day.
day.
Yeah,
D
twice
I
a
D.
day. Well, one twice a day.
Yeah.
For in most cases, depending on the condition.
7 days?
When you're managing brucella, you find someone taking for 2 weeks. When you're managing UTI, urinary tract infection, you find someone taking for 1 week.
Yeah.
So it depends. This one, a cup is just 50 Ugandan shilling. Just
50.
How
So
much?
100, 200, 300, 400, 500. 500 is like $1
Oh,
and 20 cents. Actually, not even $1.
oh,
Like 10 cents,
no.
like 12 cents.
So
Yeah.
is this real doxycycline?
Yes, it's rare.
doxycycline.
It's like 12 cents.
I think we overpay them though.
In US, how much is that in US?
$30.
$50.
What? US.
Yeah,
Yes.
there are those drugs. You have these drugs in different brands. Majorly the brand from USA is a bit expensive compared to the brands that are made from Uganda.
But it's the same.
Yeah, but they are the same.
The,
But the one for USA is stronger
the wind
than
has
this one.
brought you.
I have been following you.
No, 100 milligrams should be 100 milligrams.
Esther. Hey. How are you? How is life?
Good.
You good? Welcome. You're hot. You're sick? Oh, Josiah is making you move in the sunshine. Well, how did you come?
You came with the car, it's up there.
Hey.
But I finished my treatment today.
You were treating here? Hey.
I know my name, but not here.
I feel like this. I feel like.
I thought whatever you are sick with, he doesn't want Namaemba to
Oh,
know.
God.
I mean, the product is not as strong, I think.
No, I think it's the same. It has to be the same. If it says Yeah. If it says 100 milligrams, it should be
Then
100
it is the
milligrams.
same.
It should be.
I don't think they can write there and then it's not the same.
To think of how
So now this one is
yeah,
treatment flow.
once we had
Taking the
This
tour.
is what we are doing.
and if the spring was that very yes, I know we have
Treatment flow at the same time animal health flow. You see those patients that are outpatient, we normally do treatment from here, then they go. Even those ones who is come when they are in critical conditions, we first resuscitate them from here, then after we transfer them to the wards. Yeah, small as it is, but it is well equipped as compared to Ugandan settings facilities. We have oxygen cylinder is here, the concentrator is here. Where need be when someone whose oxygen saturation is low, we administer oxygen. We do what is necessary, we resuscitate, and after the patient regain, we transfer that patient to the ward and manage that patient from the ward.
From the ward.
Yes. So this is the cabin where you are keeping our drugs. The injectables, we keep them from here. After you see. So the other side in the pharmacy, we normally keep our drugs from there. We have a store for the drugs, but whichever drug that we receive from the supplier, keep it from the pharmacy. Then we do the direct transfers using the system from pharmacy to the treatment room, from the pharmacy to the laboratory, from the pharmacy to maternity. So the other one is like is acting as the main store for the drugs. So we transfer those drugs from the pharmacy to the different departments. So this is it. The treatment room, at the same time our emergency room.
Not for food or drink storage.
Yes, not for food. I don't think. Yeah.
Can keep your food there.
Yeah.
You staying?
I'll stay, yeah.
So meet Esther.
I met Esther today.
Oh,
A different Esther.
a different Esther. So Esther is Josiah's wife.
Oh, you're such a Josiah's wife.
Yeah. He's the one that he
Bacteria called
paid 100 cows for.
MRSA. You know what MRSA is? MRSA is a bug that is resistant to
Tom. Hey, okay. I was looking for you. Yeah.
So this is our scan room.
And you do all the scans and then the PA or the physician here reads them? Or do you send them to the hospital to read?
Report is generated by the site.
So what happens when you generate results? You explain to the patient. You're the one who explains to the patient, or you send them to the PA is like the clinic officer. That's
Those
sure.
you can explain to, there are those you send.
So some she explains, and then some the doctor has to explain. But everything she writes like in a report.
Okay.
Like after scanning, what happens?
We give reports.
Give reports.
Those of self-request, you explain. Those that were just requested, you send back.
Okay. So self-request is when someone just comes in, when they automatically just wants only getting scanned without passing at the doctor. Because here consultation is free, so someone just comes and is like, I just want, maybe for example, like the other hospital where I went in the morning, if they send someone, if they have sent someone to specifically get scanned, they'll just bring straight to here, the reception, and then the reception will send them here. They get scanned, they write a report, and then she is able to explain and then send back the other PA at the government hospital where they don't have. But if it is from like a person doing everything from within our health facilities, then she gets to send to the PA to explain.
PA in full.
PA is like our clinic officer. What is PA in full? That is a
Physician assistant.
yeah, physician assistant.
Okay.
Yeah. It's like assistant of a doctor.
Okay.
Second.
Yep.
Yeah.
And if you see something wrong with the baby, then you send them to the hospital as a referral?
Like if you see something wrong, what happens? For example, maybe you've scanned and then you found there is something not okay with the baby.
And after you explain to the mother.
You or the
Me, I can explain to the mother what I found. The baby has such and such a problem, so you advise her to seek for more medical attention.
okay.
To go and see a doctor, pediatrician, like that.
Okay.
And then they would go to the hospital to see
Yeah.
somebody there.
Yes.
If the case can't be handled
Handled
here,
here.
Yep.
if the case can be handled here,
We manage.
and then in the report the doctor will read, like the PA of this place will read, and then can either prescribe or advise anything. And if it is beyond our level, then referred to a health center or a hospital, depending on the case.
How far is the next hospital?
The next level
Next
hospital. How far is the next level hospital? Health center for or the big hospital?
Health center for.
Visesa. So Visesa is like maybe 10 minutes or 15 minutes.
Not even, just 10 minutes.
10 minutes.
10 minutes.
10 minutes from here.
Drive.
Right from here. So in case of like even a mother when is delivering and there is need for cesarean,
We refer them to Visesa.
yeah. So it's like a 10 minutes drive from here. Yeah. And then the nearby hospital would be either Bujiri or Iganga, which one?
But the same distance, as if
Same distance.
Same distance.
So the other big hospital in Bujiri, and then the other big hospital that I pointed out in Iganga before you reach the Iganga town. Yeah, so those are like the big referral hospital,
Okay.
or maybe a bigger emergency or something like that. Yeah. So Mike is a doctor, OB. How do you say that? OBGY something, and then he's a
Obstetrics and gynecology.
Yeah, obstetrics and
OBGYN.
and then he's a radiologist, imaging also. Yeah. And Ruth is our sonographer.
a sonographer, still a midwife.
So,
Because at first she did midwifery, then she upgraded in sonography.
yeah.
How many deliveries do you do a month?
How many deliveries, like in a month?
In a month, it depends. At times we have, or can have like 5, 10, depending.
So between 5 and 10.
Between 5 and 10. Yeah.
Between 5 and 10. Alright.
Laboratory room.
How are you? Good.
This is our lab. It's not be attached anything. It's not all that precious. Yeah. So small as it is, but is very quick as compared, not as such, but as compared to other facilities, the other Uganda facility settings. We are a bit equipped and according to the level. So meet Benedict Mochawe, our laboratory technician here.
Benedict.
There are two. Last time, there are two. We have Benedict and Tilly as a flank, but today is Mochawe Benedict on duty.
So this is our laboratory. By appearance it looks small, but as he has said, a number of tests are performed within it. Like giving the examples of some of the tests that we perform. We perform H. pylori test, that is for ulcers. Then typhoid test, syphilis test, malaria test, hepatitis. We do perform also HIV test, among others. These are some of the machines that we use in this laboratory. We have a microscope. Majorly, we examine for parasites, malaria parasites. Then we have the CBC or cell blood counting. Then a centrifuge for maintaining the temperature of some of the reagents we are doing. Like for example, the battery reagent, the reagent, among others. It is our centrifuge.
This one.
Yes. For some of the tests that need centrifuge in blood, we use that centrifuge. Yes, that is it.
So you do the CBC, but you don't do chemistry here at all?
No, we don't do the chemistry.
We don't have chemistry machine.
Okay.
So, but you realize Mayuge had a chemistry machine, but here I think we don't have. Mayuge has a chemistry machine.
This is hematology machine.
What?
Hematology machine.
Hematology.
CBC machine.
CBC.
CBC machine.
Yes.
So the microscope.
Yep.
And this is our printer. If we want to the hard copy, we print using that printer. Yeah.
So just as we told you in the beginning about our medic system, when the patient reaches there, she's registered by the receptionist. After being registered, goes to the doctor's room. That patient is being viewed by the doctor. Then when the doctor requests for investigations, this laboratory technician will be in position to see what the doctor has requested. Yeah, there is no need for the patient to come with paper that has investigation that has been requested by the doctor. No, we are just using this system.
Order shows up.
Yes. So this is our laboratory.
Yeah, the SC system.
This is female ward. It's unfortunately that will come when you just discharge most of the patient that will be here in the morning. This is a female ward. Today you've come when there is no patient, but in most cases you find here when the patients, all the beds are occupied, and we end up just refer some of the patients just because of the space. So this is the female ward.
Madam Jebali. Right.
So this is our male ward. It's our male ward. This is our patient. One has been discharged just inside the room. Someone is coming to open.
So, when they disconnected, there's some problem with the male ward.
At times you find you have so many patients, we end up admitting up to this side there. This is our maternity.
That is a mosquito net. That's not very long. Labor sewer.
Sweet.
got it?
So this is our labor suite.
Sweet.
Labor suite is well equipped. We have
Labor suite.
Section.
the suction machine.
Suction machine.
The suction machine is here. We have the oxygen concentrator in case oxygen is needed.
Oxygen seems suction machine.
This one.
Mm. And then the delivery bed.
We have autoclave this side.
For sterilizing.
And then these 3 buckets, we use them for decontamination before sterilizing.
Okay.
Yes.
And these are the waste, depending on the damage.
Then
The sharp ones,
bins,
bins. And for baby.
Yes, to listen.
Fetoscope.
Yep.
It is good.
But you also use these ones in USA. Oh, for you, you're using electric one.
Electric.
You're using electric. Eh?
Yes.
Even us here, I have electric. Eh?
Yeah.
But you have both.
Yeah, there's an electric one.
An electric one and this
Is
one.
it here or is it?
Yeah, you would never see anything like that in the States. That's what we use.
Yes.
Yeah.
So I have both electric and then
Yeah, we don't have anything like that.
We're pretty good.
so the moment you put on its own, just hear the sound.
That's true.
Yeah. What does it sound like?
Donate one of those to the hospital.
To the government hospital. We also have one. We also have one for ourselves.
What should we call it? Something.
Wakakupimira ku bana.
This is weighing scale. Yeah. After delivering the baby, we have to take the baby's weight using this weighing scale. Just make the baby to lie here like this and then take the reading from here. Yes.
When is the last time that you delivered? Oh, the other on Sunday when we came, there was a baby that was delivered in the night.
Yes.
Push, 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 push.
This is our postnatal. Those mothers after delivery, you first want to go from here before discharge them. This is postnatal. And just because yesterday all those wards were full, and this one was see that one is and there is something from here.
That's not a newborn baby.
Eh? No.
No.
The female ward was full, so they.
So this is a baby,
This one, yes.
baby hospitalization.
Yeah, for normally it's for just babies. Postnatal,
Postnatal.
like after mother's giving birth, they come stay here for 24 hours monitoring, and in case they are all fine, the baby and the mother, they are discharged.
I hope she
No.
didn't come in that fast.
That would be a very old baby.
15-pound baby.
Yeah.
This is pediatric ward, but as I told you earlier on, that those wards in the morning were full. And they brought this patient was stabbed by a cousin sister. So
Stabbed?
Yes.
Oh my, I see the wound.
Yeah. She was bad low, he was totally unconscious, and now has recovered. We are managing the patient from here. Now that we discharged from the other
The cousin sister stabbed him.
Stabbed him?
Yeah, on the back.
So, but this is a major pediatric ward. But just because the ward was, the ward were full, the main ward was full, we had to improvise this one because this one was free. So I had to improvise with this one, then later we shall transfer into main ward.
How long are you gonna keep it? Let's see.
Hivyo baba watu hawatasiba.
What room?
Immunization room.
Oh, immunization.
Yeah, this is where immunizing from.
Okay.
Yeah. So this is where I keep the vaccines from.
Or in the fridge.
And in a fridge, but only at this faulty. Now they are improvising the one for the laboratory.
The laboratory fridge.
The laboratory fridge.
Okay. And in case you are going to immunize from out, those are the carriers.
These are the
we
vaccine
use.
carriers. Yeah, so these vaccines we are getting them from government facilities. So in case we are going to pick the vaccines, we use these carriers. In case we are going for outreaches for immunization, because for us here in Uganda, we normally go for outreaches, for immunization outreaches. There are people in the villages there who don't want to immunize. They don't know the importance of immunization. So what we do, we go to those areas and then immunize the babies.
You sensitize them and then
Immunize. Yeah, so we use these carriers to carry the vaccines to maintain the
temperatures
of the vaccines.
Do you put ice blocks there?
Yeah.
Ice blocks.
These ice packs.
Ice packs.
So this is AsOne, small as it is, but we are offering
Lots of services.
Looks like a step above the government level.
Yeah, there are many things that are here that are not in the government health
It's
center.
also
Clean and
looks
brighter.
more clean and well maintained.
Yeah, cleaner.
Better.
Yeah. More staff, even more working time, because here we work 24/7. Both midwives and nurses, they are full time. Like there are those that are going to work night time, they are now resting, and they will come back, they will change shift. And being that the health facility is on the roadside, there are many accident patients that they also bring.
Oh, yeah.
Like whenever an accident happens, you see people rushing, and sometimes they just passerby, they just bring a patient and drop them there. Then you just work on a patient, you don't know them, you don't know their relatives, until they gain consciousness, then you follow up later.
Yeah, we know that. John Doe, Jane Doe. Don't know their names.
Yeah, Jando and Jando. So that has marked the tour of Healing Grace Medical Center. Yeah, Idudi. It's a health center that is located in Idudi on the road from Iganga to Bujiri, the Jinja-Busia road, and it's really helping to provide treatment to many people. And we thank God for the health facility. That is the main road there. Yeah. So thank you for watching. Thank you for following and for subscribing. God bless you. We sign out.